Improving the coordination of NDIS-funded supports. The NDIS aims to provide people with disability the support that they need. At its foundation is a principle of individual choice of supports and support providers, with some choosing one provider and others choosing several. While achieving a more personalised service, this also requires providers who might not have worked together in the past to collaborate to provide the best support. This collaboration is especially important when support needs are complex or when participants' safety is at stake. So how can service providers better collaborate to support NDIS participants? Funded by the Australian Research Council, researchers across 3 universities have been investigating how service providers have been adapting to the NDIS and finding ways to collaborate. We asked 3 groups in southeast Queensland to be part of our research: NDIS participants, frontline staff and support coordinators, and service organisations and providers. We also went online to find out how well connected disability organisations and agency websites were. We asked them everything from how they go about connecting with other service organisations, what opportunities and challenges they experience to coordinate supports, and where they see improvements can be made. And here is some of what we found. For participants, the increase in providers has allowed greater choice in how they receive their supports, but it is more challenging to manage multiple providers when good support coordination is lacking. There are also new risks for participants who now have to think more about the quality of providers, often with limited information. The role of a support coordinator was also seen by many as a safety net for NDIS participants to help navigate the scheme, multiple providers and funding arrangements. Since the introduction of the NDIS, lots of new service providers have entered the market and existing ones have restructured, changing services, staff, and adapting to new system requirements. Service providers expressed concern that providing just part of an NDIS plan and not seeing the whole plan could lead to confusion about responsibilities and accountabilities to participants and create quality and service risks. Many service providers also thought that good locally based coordination of supports could now be more challenging in this funding environment unless there are trusted networks and relationships. Further, service organisations see the disability market as more competitive now, making some of them sometimes more hesitant to collaborate or share resources. And across providers, NDIS participants and families, and government agencies, a lack of effective communication and information sharing created confusion of roles and responsibilities. As a result, we found that the coordination and implementation of the NDIS could be improved, particularly in delivering services and support to those with highly specialised needs and those living in regional and rural areas. Good locally based coordination of supports using trusted networks and relationships was sometimes identified, but were often difficult to maintain without dedicated funding support. Overall, establishing and maintaining good relationships with and between providers was seen as critical to reduce risk and enhance quality of coordinated supports, but it was not clear how to achieve this. So what can we do about this? We recommend a response based on 4 pillars. Improve openness of information and communication so that everybody can access accurate information about the plan and its supports. A practical measure here could be to have online systems that provide clear and transparent information about quality and availability of local providers, and the process for identifying and reducing risks. Make clearer the roles and responsibilities of each actor in the NDIS. A practical suggestion here is for the NDIS to provide more guidance and help to promote localised collaboration. Create systems for accountable delivery of funded supports. This could involve more practical supports for NDIS participants to identify, assert and resolve risks and concerns about support provision, including disability advocates. Or local area coordination could be expanded to help participants and providers avoid failures in support provision. Improve skills and reliability of organisations and workers to ensure quality and safety in service delivery. This would require more investment in building the skill levels and capability of key NDIS workforce members, such as planners, LACs and support coordinators. The NDIS is an evolving scheme. By taking these steps, we can enable service organisations to work better together for the benefit of NDIS participants and their families. For more information on this project and the resulting detailed policy options, please visit our website.